Hello, my name is Dr. Nicholas Cohen. I'm a family doctor and I'm here to share with you a top 10 list of tips for pregnant women to know when you might be in labor. If you think you're in labor, you should call your midwife or doctor. Here are 10 tips for knowing when you might be in labor. The first tip is regular contractions. If you're feeling contractions, which is a tightening, a painful sensation that can occur in your stomach or in your back, then time your contractions for over an hour. If you have about 5 contractions or more in an hour, and each contraction lasts about 1 minute, then this is a good sign that you might be in labor. On the other hand, false labor, or Braxton Hicks contractions, usually don't happen regularly and don't usually happen for about a minute and as frequently as 5 times per hour. Tip number 2, contractions despite movement. If you feel you're having contractions and your contractions get better by walking around or changing position or resting, then that's a good sign that you might not be in labor. Contractions that occur regardless of whether or not you move around are more likely to be the contractions of labor. Tip number 3, contractions that are strong. Contractions that are strong are more likely to be the contractions of real labor, while contractions that are light and aren't as painful are more likely to be false labor or Braxton Hicks contractions. Tip number 4, contractions that start in the back and move to the front. Contractions of labor usually start in the back, in your back, and then move to your front. Contractions of false labor, on the other hand, usually just occur in your front. Tip number 5, a gush of fluid. A gush of fluid is another sign that you might have broken your water, and this is a sign that you might be going into labor. If you do have a gush of water, or if you have any of the signs that I previously described for labor, you should call your doctor or midwife. Tip number 6, a bloody show. A bloody show, or a mucus plug, is a quantity of mucus with blood that women often have right before or during their labor. This is usually a sign that the cervix is beginning to dilate. If you do have a bloody show, call your doctor or midwife and find out if you should come in. Tip number 7, bleeding from your vagina. If you experience bleeding from your vagina, this might not be a sign of labor, but it's an important symptom for you to report to your doctor or midwife immediately. So if you do have bloody discharge from your vagina, call your doctor and find out what to do. Tip number 8, contractions occur separately. They come and they go. If you happen to have pain that doesn't go, it's a constant severe pain, then call your doctor or midwife immediately. This might not be a sign of labor, but it might be a sign of a complication of pregnancy that's very important to talk to your doctor about immediately. Tip number 9, if your baby isn't moving, then it's important for you to contact your healthcare provider or midwife. A decreased fetal movement is an important symptom that your healthcare provider should know about right away. And tip number 10 is to believe in yourself. Pregnancy is an exciting time, and these are some important clues to knowing when you might be in labor and should seek care from your healthcare provider. So I hope these tips are helpful, and have a great pregnancy. Thank you.